Hi, I'm Nolan, and I'm going to be responding to Max Monker's debate stating that the World Health Organization is not an effective tool to combat COVID-19. Max started his debate by referring to the World Health Organization response to H1N1 and Ebola prior to COVID, claiming that their ineffective responses to those viruses showed that they were incompetent to be able to handle global pandemics. He also said that the World Health Organization commending China for their transparency essentially invalidated the work that they had been doing, when in reality our own president also commended China for their transparency, because at the time we had no reason to believe that China was not being transparent with their information. When it comes to H1N1, the argument against the World Health Organization is that they prematurely called it a pandemic because of pressure from pharmaceutical companies. This has since been disproven by multiple different third-party investigations. Another issue people have taken is the calling of H1N1 as the swine flu, which the World Health Organization instituted as a way to avoid repercussions on the Mexican economy if they had gone ahead and called the virus the Mexico virus, in the same way that we see the United States political leaders referring to coronavirus as the China virus. Both of the decisions that the World Health Organization made were made in an appropriate manner based on the info that they had and they were able to analyze in short order. Even with some of those unintended consequences, taking decisive action saved lives. And when it came to Ebola, the criticism was that they didn't act fast enough in that fight, when politically you can understand, after the backlash they received for acting too swiftly against H1N1, why they would be hesitant to react in the same way against Ebola. No one thinks that the World Health Organization is perfect, but their ability to analyze and report information to the world is entirely necessary for our safety and the safety of the entire world. We see this in the way that the World Health Organization has handled COVID. They announced to the Americas back in January that we needed to be prepared for COVID. They declared it an emergency on January 30th. In March, they called for a 40% increase in PPE manufacturing. They worked with the G20 to guarantee free movement of PPE and other essential medical equipment so that equitable distribution could be achieved. They fundraised $127 million for COVID response efforts, and they led the charge on mask wearing, providing clarity for its effectiveness. And well, yes, the World Health Organization is reliant on compliance from their member states. Their leadership, research, and unwavering determination to inform the world have allowed us to effectively fight back against a virus that we otherwise had no prior knowledge or preparedness for. Lastly, to say that continuing to respond to the virus under our American model of continuing to live through it and fighting together is a blatant disregard for the essential science and support that the World Health Organization provides. We need to listen to the World Health Organization more, not less. Living in America, we may be biased to the effectiveness of the World Health Organization, but that is not because the World Health Organization isn't doing their job. We have that bias because our political system has rejected the information and the work that the World Health Organization has done, in the same way that we are rejecting the science and information being provided by our own medical experts here in this country. The World Health Organization is an effective tool to combat COVID-19, and if the United States spent more time working with the World Health Organization rather than trying to retract their membership, we would be in a much better situation.